Hello, it's Dr. Ario here. Welcome to my channel. Thank you for tuning in. So today we are talking about self-breast examination. See, as women, getting used to doing regular self-breast examination is so important. This is so that you are familiar with your breast, so that if there's anything different, you are likely to pick it up quicker and seek help when you need it. Luckily, most of the changes that we actually see in the breast are normal and happens due to normal hormonal changes that the body usually goes through. So doing a self-breast examination is not to scare you. However, it gives you the confidence to know what is normal, so you can pick up any abnormalities when they happen and seek help on time. So when should you do a self-breast examination? Well, there is no strict law to it. Just pick any day of the month that you are comfortable with. Currently, the recommendation is that it's better to do it a few days after your menstrual cycle, after your period, a few days after that. So give yourself maybe a week after your period to actually do your self-breast examination. This is because during the menstrual cycle, your body goes through a lot of hormonal changes, and that sometimes can cause changes in the breast that may be confused with something abnormal. So it's usually very good to wait a few days to let all those changes settle and then do the examination. Now you may be wondering, what if I don't have a period at all? Maybe, I'm in the menopause, or what if I have irregular periods, or sometimes I don't have a period, I don't have it on time. Well, it doesn't matter what you do. Just pick any day of the month. You might decide that you want to pick the first day of each month, whatever is convenient for you, and then stick to that. As long as you're doing that regularly on a monthly basis, that's all you need to know. So for the purpose of this examination, we're going to use this mannequin called Model A. It is always very important that you are fully relaxed when you're going to do your self-breast examination. Maybe choose a time when you're getting ready to go into the shower. Make sure there's no distractions and you are ready to do your examination fully, okay? It's important, of course, that the breast is fully exposed so you can see it and be able to do a proper examination. You can choose to either sit down on a seat upright, or you can choose to stand to do your first part of the examination. So to actually go ahead and do your examination, you can be doing this standing in front of a mirror so you can actually see what you're doing. So the first thing really is to just stand and look, okay? And what are you looking for? You're looking to see whether you can see any differences between the two breasts, okay? That would be the first thing. So you're looking at the shape. Does it look the same? Like I mentioned previously in one of the videos, I said often, we may all have a slight variation in the sizes of the breast, but it shouldn't be anything very obvious, okay? So you're looking for the shape, you're making sure that the contours of the breast actually look the same on each side. So you're looking to see whether there's any discoloration on the skin. Do you see any dark pigmentations? That shouldn't be there. Is there any red rashes? That shouldn't be there, okay? Then you're looking at the nipple area to make sure, is the nipple pointy as it should? Is it pulling inwards or not? So you're just looking basically. Then the next thing is to raise your arm up high above your head. The reason you do this is so that if there's any lumps that may be hiding on the chest wall, when you do that, actually the muscles of the chest tense up, and therefore they're able to expose anything that you did not see just by looking. Then the next thing you do is to actually press your hands against your hips, okay? And then lean forward a bit. And what you're doing is that if there's any lumps, actually, they do move forward. So if there's a lump in one breast, it's more likely to show when you do that. Just imagine gravity. Gravity tends to pull things downwards, isn't it? So if there's a big lump hiding somewhere in one of the breasts, actually doing that will make that abnormal breast, sort of stand out a little bit different, okay? Now, once you've done that, you can put your arms down and relax. So the next part of the examination is the feel approach, okay? This is when you actually feel the breast, okay? And what are you going to look at? You feeling for any lumps, yeah? This part of the examination is done lying down. It is always best to examine the breast lying down because it allows the breast tissue to spread evenly across the chest wall, and therefore makes it easier when you are examining. Okay, so when you lie down flat, make sure you're lying on one pillow. Okay, and then choose which side of the breast you're going to examine first. So if you're going to examine the left side, which we're going to do now, is to make sure that you put one hand, that same hand, on the same side you're going to examine at the back of your head. Okay, so just imagine that you are ready to examine yourself. Now there's different approaches that people adopt. There's no right or wrong way of doing it. Actually, the main important thing when it comes to examining the breast is that you cover the whole of the breast so you don't miss any parts. Okay, so people sometimes adopt the circular motion when they may start from one point and basically just move around until they cover the whole breast, or they may adopt the up and down approach, which is what we're going to use today. Okay, so if you're going to examine the breast, first of all, just sort of visually have an understanding of the borders of the breast. Okay, now the breast tissue actually extends all the way higher up to about the part below the collarbone. Okay, so what you need to do is just imagine that's your border, then you work all your way around, all the way around just to the side of the armpit, and then come on up again. So if we're going to use the up and down approach, we just pick an area. Maybe we're going to go from the outer part of the breast. Okay, when it comes to which finger you should use, don't use one finger because you're more likely to just miss things. Okay, if you use two fingers as well, you're more likely to separate the breast tissue, so actually you miss things as well. So the recommendation is use 3 fingers. Okay, so what you want to do, pick a point you're going to start from, and if we're going to use the up and down approach, we want to go in a very systematic way. So we're going to move in small but careful and deep motions. Yeah, that's what we're going to do. As you can imagine, I'm not lifting my hand like that, because you're going to miss things. Yeah, so you want to go and small motion overlapping, okay, with the areas where you're examining. Okay, so you're going all the way, and you want to take your time. And this is why it's so important to know when you're going to do your breast examination, so you give yourself ample time to be able to do your examination without anyone rushing you, without being distracted. So perhaps even put your phone on silent so that you're not getting distracted while you're doing this. Okay, this is really an important part of your life as a woman, that it should be part of you. So as you can see, I'm not even lifting the fingers off the skin. Okay, I'm basically just going overlapping motions, okay, to make sure that I'm covering the whole area. Now, as you can imagine, this is a very hard model that I'm using, so it's a bit difficult actually, but I'm making the most of it. But I hope you actually just get the idea of what I'm trying to show you. So I'm just making sure that I'm covering the whole breast. There's no point rushing at all, because breast cancer is real, and if you can do your part as an individual to make things easier for yourself, then don't take it for granted. Okay, so that's what you do. Basically, you make sure, yeah, just remember, don't use your fingertips, use the pads of your fingers, okay, as you're doing that. Obviously, now this is a bit difficult to just get this past this area because of the hardness of the model I'm using. But essentially, you need to make sure that you cover the whole of the breast. And now that you're happy that you've done that, you need to revisit the nipple area, okay? Because sometimes lumps can actually hide behind the nipple, okay? So you need to come and examine the nipple area, yeah? And then the other thing that you need to do is the nipple squeeze test, okay? So normally you shouldn't have any discharge from the breast. It can be normal to have a discharge maybe if someone is pregnant and they're getting ready, the body is getting ready for lactation, they might discharge some milk. But normally you shouldn't, all right? So when you squeeze the nipple, if you notice any discharge of any form, clear discharge often is not worrying, but any milky discharge, any yellowy discharge, any green discharge, any red discharge, any discharge really that you're not sure about shouldn't be there, like I said, then you need to see the doctor about it. So that's something to remember to do if you haven't done that, to do the squeeze test, okay? Now, once you've examined the breast and you're comfortable, you've done it right, okay? Then the next thing is actually to examine the surrounding areas. Most cancers, when they spread, before they go to another organ at all, will go to the closest area to them. So when it comes to the breast, actually, the armpit is usually the place that things would spread to first, okay? So once again, remember your hand is behind your head, okay? So the armpit is actually nicely exposed, okay? So just like you did with your fingers, you examine the armpit area, and once again, you're feeling for any lumps. Now, lumps may feel like hard bits. They might feel like a walnut. They might feel like a pea. Just a hard lump that shouldn't really be there. That's what you're feeling for, okay? So once you've done that, then you need to always compare with the opposite breast, okay? Now, often it's unlikely that breast cancer will just happen in the two breasts at the same time. So often people will notice symptoms in one compared to the before they get anything in the other one. But it's always good to compare so that you don't miss anything. So you just repeat exactly what you've done on the left side, on the right side. And that's really the whole examination done, okay? You can be done. Once you get comfortable with doing it, it becomes part of you, so you can actually do it in less time. Now, you know, breast cancer is real and it's affecting a lot of women, all right? Even in Africa, breast cancer, cervical cancer is the main cause of death in an African woman. And I know people living in that part of the world, often it's difficult even to get the help that you need. But guess what? Doing a self-breast examination is something that you don't have to pay for, something that you can do in the comfort of your home. And when you get confident in doing it, it becomes part of you. You can pick the changes early and seek help early, okay? Because actually we can treat and cure cancer if it's picked up early. So please always make sure you do it. Remember, you can do it any time of the month. It could be a few days after your period, or you can just choose any day of the month basically and go for it. Just make sure that you're doing it every month. Okay. Now, if you're a woman over the age of 50, here in the UK, the National Breast Screening Program is available for people over the age of 50. So normally you would get your letter in the post. Please don't leave it unattended to. Make sure that you go for your breast screening. You may be living in other parts of the world where they have different schedule programs. Make sure that you find out, educate yourself, find out what is available in your community, and make sure that you do access the help that you need. Yeah, prevention is better than cure. So I hope you've learned a lot today, and I hope that you will start to put into practice if you're already not doing this, okay? So from me, Dr. Ariel, and the rest of the team, thank you, and bye-bye.